I've seen a girl who came in for football practice. She had 2 concussions in one practice. I've seen a kid who got hit in hockey, seen a kid who football practice again. Our kid was knocked unconscious during a football game. And then we have another woman who's coming in and she was actually in a car accident. But she's older, so people don't always necessarily think about the other ways you can get concussions. Some of the immediate signs will be confusion, dizziness, difficulty with light. So if they're squinting a lot, sometimes they can't answer questions very clearly. Sometimes people don't remember before or after of what happened. Somebody might have headaches immediately after the hit, dizziness, confusion, might not remember before the hit, after the hit. Especially with kids these days, they might not be able to watch TV as long as they normally would, might not be able to focus on their phone. So if you notice that your kid's usually glued to their phone and they can't, that's a sign. Or if you notice that they're either not sleeping well, and they usually do, or if they have difficulty falling asleep. When they come in, I'll first look at 3 things. I'll look at their neck. So I'll look a lot at posture. I'm going to look at how much movement their neck has and any kind of tenderness of the muscles. I'm going to look at the oculomotor system. So I'm going to look at how their eyes are communicating with their brain and see how everything's coordinated. And then I'm going to look at the balance system, because people don't always realize it, but the balance system can be disturbed when you have a concussion. Depending on what realm is most affected, so if it's more of a neck issue, we're going to work a lot on posture, stretching, and making sure everything's communicating. That way you don't have that extra muscle tension. Then if there's more oculomotor deficits present, so I'll make people follow my finger, I'll make people use metronome timing, look at different targets, make you do it sitting, standing on one leg, counting backwards, really bringing in all systems to make your body multitask. If it's balance issue, we have uneven surfaces we can put athletes on. We can do a trampoline toss, like make sure people have good hand-eye coordination, make sure they're safe to return to sport. A lot of times I'll bring parents in, kind of review what I found. And some parents are really surprised. Some, especially mothers, get worried and they don't really want their kid to do anything. But research is finding that's not the best solution right now. It's more of like that graded exercise. So similar, if you have a weak muscle, you got to slowly work up to it. So it's back to where you want it to be. So I'll bring in a lot of visuals. It's really, education is a really important part of what we're doing. So I'll show them some of the findings so that they know what I'm talking about. I think people need to realize that it takes time. Your brain operates much like a muscle. So if I have a goal of squatting 200 pounds, I can't go off and squat 200 pounds right away. That's not going to work. So you have to gradually build your brain back up and make everything reconnect so that it's able to do it at a safe rate rather than an immediate rate. If your kid has a concussion, it's okay for them to rest from sports if that's what's causing your issue. When in doubt, send them out is usually the grounds that they're playing with. But right now, if you have a concussion, you don't need to be scared about it. Just know that similar to any other injury, there's treatment for it. So when I was younger, I had a concussion, and although I wasn't affected long term, I know some people who have now difficulty going through their computer for work. They have difficulty with coordination, balance. They still get headaches when they try to read. And I think it's really important to address these things early so that as these kids become adults, they aren't debilitated by something that happened in their high school athletic careers.